of discussion is going to be on what are the tests to be performed on an infertile couple. All the tests need not have to be performed on all patients, so that is a call that will have to be taken by your doctor. But we'll just discuss in brief what are the tests that are usually performed on a regular basis, and then I'll also let you know regarding the advanced tests that can be performed in certain situations. So coming to the basic tests that have to be performed in a couple, one is that you have to know your blood group. Second will be your complete blood count. Now, complete blood count will include your hemoglobin, your total white blood cell count, your platelet count, and other parameters pertaining to that. Then we come to your thyroid test, that is your TSH and your free T4 levels. Then we'll do something called your prolactin levels. Mainly, it is done in the females if and when she is in the first 15 days of a menstrual cycle. It is better to be performed at that time. And also, it is performed in women who have complaints of nipple discharge. It definitely has to be performed in these patients. Then we will check for your sugar levels and your liver function test and your creatinine, that is for your kidney functions. These are the tests that are usually performed in the female. Now coming to the tests that are performed in the males. So in males again blood group, then we will have to see for their hemoglobin count if they have any complaints, and we'll also see for the TSH levels, that is the thyroid hormone levels, the 3-month sugar average, that is HbA1c, or we can also do a fasting and postprandial blood sugars. Now, why are these tests done? So, one is whether to see whether you're fit for any kind of treatment, whether the lady is fit to go ahead with procedures or go ahead with treatment, and also whether she is fit enough to carry a pregnancy. Second, any issues with the thyroid hormone test or the prolactin levels can be the reason for her infertility. So it's not that basic tests are only done for fitness. Many of these basic tests will also give us an indication as to whether these simple tests can actually rule out many of the infertility causes. And if they are corrected, then you're actually just treating the infertility there itself. Third is again when you're doing it for men. Why do we do TSH and 3-month sugar average for or sugar test for men? Is because again thyroid hormone disorders can have an impact on the sperm motility and morphology. And if the man is diabetic, if he is an unknown diabetic, we diagnose it, or if he is a known diabetic and if the sugars are not under control, again this can lead to abnormalities in sperm parameters. So these are the basic tests that have to be performed in all the couples that usually come for infertility treatment. Now coming to advanced tests. Now advanced tests are something that are not done routinely. Why? One, because they are not indicated in all patients. So you don't need to go through advanced testing unnecessarily, where you will be just doing tests, spending money on that, and you will actually not have any outcome out of that because it's not indicated in you. So when do we do these advanced tests and what are they? So I'll just give you a brief about a few of the tests, because when we actually discuss in detail, there might be very many tests which might not be useful for this particular video. So I'll just give you a briefing of a few of them. So in women, what are the advanced tests that we can do? One is something called tube test. Now tube test is a very lay word what I'm using. The proper word is your hysterosalpingogram or a sonosalpingogram. Why is hysterosalpingography done? Now hysterosalpingography is done in women to check for the patency. Patency is whether your fallopian tubes are open. So it is done to check whether your fallopian tubes are patent. How does this help? Because if you want to try and conceive naturally or undergo simple treatments like ovulation induction or intrauterine insemination, you have to have patent tubes. Otherwise, the success rate of these treatment modalities are going to be very less. So that is one of the tests that we perform. That is your HSG, that is hysterosalpingography. Second is a diagnostic laparoscopy and a diagnostic hysteroscopy. Again, this is not indicated in all patients. So your doctor will decide as to whether you require a laparoscopy, hysteroscopy, because this procedure again is done under anesthesia. It is like an operative procedure where you're given anesthesia and a camera is introduced into your abdominal cavity. That is in laparoscopy, where we can see your uterus, tubes and ovaries directly under vision. And we also introduce a camera into your uterus through your cervix, that is called hysteroscopy, where we can see the lining of your uterus, whether it's healthy, whether you have any uterine abnormalities. Now, this is again not indicated at all in all the patients, so your doctor will be the best person to guide you as to whether this is actually required in your case. Coming to males, now what are the advanced testing that we can do in males is again one is something called DFI, that is DNA fragmentation index. Now this test will let you know, how many, what is the percentage of fragmented or unhealthy sperms that have been affected by reactive oxygen species or stress, affected by stress in your body. That is called DFI, that is DNA fragmentation index. Again, this is not recommended in all patients. So your doctor will decide. So it is mostly recommended for patients who had previous failures of treatment, repeated failures of treatment, patients who are long-standing diabetics or hypertensives, smokers, because in these patients the DNA fragmentation of sperms is on a higher side. And when that is on a higher side, we can offer advanced treatment modalities as well for these patients, which will help them and give a better success rate for pregnancies. What other tests can be done? Now, depending on again history and the patient profile, we will decide, like if a patient has come with repeated miscarriages or repeated IVF failures, we have to do also some tests, rule out any genetic abnormalities in the patients, which can lead to this kind of repeated failures in treatments. So what is that test? That is called karyotyping. So in karyotyping, what do we see? So we see the chromosomal pattern of the male and female. Whether the chromosomal numbers are normal, whether the chromosomal pattern is normal is checked. And also there is something called antibody testing in women who have had history of repeated miscarriages or repeated IVF failures or repeated treatment failures. Now what are these antibody profiles? One is your APLA profile, that is anti-phospholipid antibody profile. Now, patients with repeated miscarriages can at times have this antibody profile which is positive. So this has to be tested, and accordingly, your further treatment will include some kind of corrective measures which will prevent the miscarriage again. So that is one test that we have to do. And patients who are having fluctuating thyroid levels, or even patients who had repeated failures of treatment, we can do another testing, that is your thyroid antibody profile testing. So these are all advanced tests and not indicated in every patient, especially if it's your first visit, short duration of married life, young couple without any other comorbidities might not require all these advanced testing. So it's always best that your doctor decides which test is applicable to you as a couple, and you can follow their advice accordingly. So I hope this video has been informative for you, and if you liked it, please subscribe to this channel. You can share this video with your friends and family so that they get better understanding as well. And if you have any more queries, you can always get in touch with us through the website, or you can contact us on the number that is provided in the description. Thank you very much.